Hi friends, welcome to classes by Lab Doctor. I am Dr. Divya, and in today's class let us discuss what is the normal range of this HDL and why do we get low HDL levels in some people. See, HDL being low carries risk of various diseases, especially risk to your heart, because HDL is cardioprotective. It is a good cop. It cleans up the city. HDL is the one which will protect your blood vessels of your heart, and it will protect your heart health. Also, it will stop the inflammation. It is antioxidative, it is antithrombotic, anti-inflammatory. So we expect that the HDL levels are higher in our body. We expect the HDL level to be more than 60, but if the HDL levels are coming less than 50 for a woman, and if it is coming less than 40 for a man, then the heart is at risk. So this HDL has to be in a higher range to protect our heart, to protect our blood vessels. Now, why do we get low HDL levels in our body? So the main thing, the main factor which will contribute to your low HDL in your body would be your lifestyle. By lifestyle, I mean smoking. If the patient is excessively he is smoking, then that will reduce your HDL and it will increase your bad cholesterol, that is your LDL. If the person is drinking excessively, excessive alcohol consumption can also reduce your HDL. Obesity, excess of weight, especially this abdominal fat, is associated with low HDL level and increased triglyceride level. There is no physical activity. The person is not moving, he is not active, there is no exercise at all. These can reduce your HDL. And we are having a high carbohydrate diet, or we are having diet which is not balanced. That can also cause low HDL level. So basically what we are dealing with is the lifestyle, and these lifestyle factors are the main contributors for low HDL. So whatever low HDL we see, either it is because of one of these factors in majority of the patients. Yes, there are other causes for low HDL also, but these are the commonest factors: the smoking, excessive drinking, obesity, there is lack of physical activity, and having increased carbohydrate, fat rich food, etc. So how does HDL go down in obesity? So what happens is, in this obese individual, they have increased uptake of this HDL by these fat cells, and also there is increase in the breakdown of apoA-I in these fat cells, because this apoA-I is a major protein in this HDL. We have seen that. So there is increased breakdown. Once there is increased breakdown, the HDL level itself starts getting less. And because of obesity, the adipose tissue, the function, the morphology of this adipose tissue also changes. This is going to impact the HDL metabolism and also the cholesterol efflux. And obesity is a state of chronic inflammation. Whoever is obese, there is chronic inflammation going on in the body, and this inflammatory cytokines which are released, they can negatively affect your HDL. And definitely obesity is going to cause insulin resistance, and insulin resistance is going to cause dyslipidemia, including your low HDL, increased TG, increased cholesterol, increased LDL, VLDL, etc. Second condition which would cause or lower your HDL would be your type 2 diabetes. So type 2 diabetes will lower the HDL, and low HDL will increase the insulin resistance. So it is a vicious cycle. So diabetes, usually when we see a diabetic patient who is having uncontrolled blood sugar, we usually see that that person is having high triglyceride and they will have low good cholesterol or low HDL. And because of this, patient will usually have other symptoms also, like patient will have high blood pressure, he will be obese, he will have increased abdominal fat, there will be high triglyceride, etc. So that is the metabolic syndrome. And this you will see that in obesity I was talking, there is dyslipidemia. So the TG increases, the cholesterol increases, HDL goes down, LDL increases. That will cause insulin resistance, and whenever there is insulin resistance, that will lead to type 2 diabetes. So whenever there is type 2 diabetes, what happens? The apoA-I, which is the main apoprotein in HDL, the transcription of that is reduced. The HDL clearance gets increase, and there is increased sugar, the glycation of this HDL lipoprotein happens, because of which what happens, the HDL functionality, the structure and function of this HDL changes. apoA-I is reduced, HDL also gets reduced. So the function and the structures of apoA-I and HDL are low or reduced, and because of that it affects the reverse cholesterol transport, the antioxidative function, the anti-inflammatory function, anti-thrombotic function, everything gets affected. So all of these are interlinked: obesity, dyslipidemia, insulin resistance, HDL, etc. So here you can see that in type 2 diabetes what happens, in whenever there is impaired efflux or whenever there is impaired antioxidant capacity of this HDL, that will lead to cell lipotoxicity. So this increased lipids in the body, what they will do, they will damage the cells in the pancreas also. There is increased apoptosis. HDL is an anti-apoptotic agent. So now there is less HDL, the apoptosis, the cell death increases, because of which what happens, there is impaired insulin secretion. If there is impaired insulin secretion, the glucose uptake, the glucose utilization is hampered, and if there is impaired glucose uptake happening, then there is hyperglycemia, hyperinsulinemia. So once there is hyperinsulinemia, that will again affect the HDL. That is going to change the structure of this HDL. That is going to make alteration in its proteome. That is going to cause glycation of this apoA-I. That is going to change the structure of this HDL. And this changed HDL is again going to cause the same thing. So this becomes a vicious cycle in diabetes. Yes, thyroid abnormalities can also reduce your HDL cholesterol, especially the hyperthyroidism can reduce your HDL cholesterol. So now kidney disease. So kidney disease can also cause decreased HDL levels. So how it does reduce the HDL level? This chronic kidney disease is associated with this low HDL levels. Whenever we see patients who are having chronic kidney disease, and they will have this HDL level less, and this will also help in the progression of the kidney disease itself. So what happens is, in this chronic kidney disease, this HDL particle, it becomes dysfunctional. So the function, the structure of this HDL changes. So because of which it loses the ability to do its function. Function of what? Carrying the excess cholesterol or its antioxidative property, anti-inflammatory property, etc. And also kidney plays an important role in breakdown of this HDL. So when the kidney function itself is hampered, this can disrupt the process of HDL metabolism. So then what happens? There is low level of HDL, and that too with an altered function. In chronic kidney disease patient, there is deficiency or low level of this enzyme lecithin-cholesterol acyltransferase, which is very important in the HDL metabolism, because if lecithin-cholesterol acyltransferase is not there, the free cholesterol is not converted into cholesterol esters, and if that is not happening, the excess cholesterol is not being cleared up. So that can also cause low HDL level, and you will see that because of which what happens now, this will increase the risk of cardiovascular disease. It will also increase the progression of this CKD, because what happens is whenever there is low HDL, there is increased renal vascular atherosclerosis. The renal blood vessels, there might be atherosclerosis there might be glomerulosclerosis, there might be tubulointerstitial injury, etc. So this can also damage the kidneys. Kidney damage can cause low HDL, and low HDL can cause again the kidney damage. So this was what I was talking about. So this is an HDL which acts as a good cop. It has various protective functions in the body, being it the remover of excess of cholesterol from our body, to protect our blood vessels, to stop the inflammation, to reduce the apoptosis. It is having the anti-atherogenic properties. It will prevent the platelet aggregation, hence the thrombus formation, hence the plaque rupture. It will prevent the LDL oxidation, hence the formation of this foam cell, atherosclerosis. It stimulates the production of nitrous oxide, hence it dilates the blood vessels. It will prevent the formation of this atherosclerotic plaque. And once there is reduced HDL, that is when it starts causing the damage. There is decreased anti-inflammatory capacity, so there is increased inflammation, and inflammatory mediators can bring a lot of havoc to the body. There is a diminished ability to prevent the oxidization of this LDL, so that is going to again cause damage. There is impaired efflux. The cholesterol removal itself is very slow, so when it is not removed, it stays back. It is going to stay back in the blood vessels, and that is going to damage the blood vessels, and that is also going to affect your heart health. Because of decreased function of all of this, there is damage to your heart also. So these were few of the other causes which were reducing the HDL level. Certain medicines can also reduce your HDL level, especially the beta blockers which are used to treat your blood pressure. Sometimes they can reduce your good cholesterol. Thiazide diuretics, which are given to remove the excess fluid in your body, that can lower your HDL. Androgens, that is the male sex hormones what we give sometimes, that can lower your HDL. Progesterones, these are the female sex hormones which are there in the hormonal pills, etc. Sometimes they will lower your HDL. Anabolic steroids, they can also lower your HDL. So all these medicines can also lower your good cholesterol. There are certain genetic factors, like you have, the familial HDL deficiency. So in this condition, the HDL levels are very low. Then you have the Tangiers disease, which is a rare genetic disorder which will cause severe deficiency of HDL. HDL level are very low, less than 5 milligrams. And then in certain condition, there is apoA-I deficiency. So what happens is there is a mutation in the genes which will produce this apolipoprotein A1, and this is a very important part of the HDL. The majority of HDL is made up of this apoA-I. So once there is damage to this apoA-I itself, so the HDL will be less, and there is mutation in lecithin-cholesterol acyltransferase. So this also is very much important in the function of this HDL, and if that is also less, if the LCAT gene mutation occurs, then also you will get less of this HDL. So these are few of the genetic factors which can reduce your HDL levels. So I was telling about this Tangiers disease, and one of the pathognomic features what you see here is this grayish yellow orange tonsils you will see in these patients, because what happens here is this in Tangiers disease, here there is a mutation in the gene, that is the ATP-binding cassette transporter gene, and because of which the efflux from the peripheral tissues, the efflux of the lipids from the peripheral tissues hampered, and also the HDL level gets, and also there is low level of HDL, and it can be as low as 5 milligram per deciliter, and apoA-I is also very low in this condition. The patient will have hepatosplenomegaly, etc., and intermittent peripheral neuropathy. So these were the genetic causes which could reduce your HDL. So what are the reasons for low HDL? What we see, suppose if the HDL is less than 40 in men and if it is less than 50 in females, we call that person is at risk, or that we expect the HDL to be more than 40, or so we expect that the HDL should be more than 40 for men and more than 50 in a woman. Suppose if it is less, it can lead to various health issues. And what are the causes for this low HDL? I've told you, one is your sedentary lifestyle. There is no exercise. The kind of food you eat, which is rich in fatty acid, trans fats, which is high in carbohydrates, high in processed fats or sugars, refined in bakery products, etc. So there is no balanced diet. So when there is a bad diet accompanied with no exercise, which leads to obesity, along with that the bad habits like excessive smoking, excessive drinking, all these can lead to low HDL. Suppose if the patient is having uncontrolled diabetes, he can have low HDL. If the patient is having chronic kidney disease, he can have low HDL. Patient is having hyperthyroidism, then there can be low HDL. Patient is on certain medications like thiazide diuretics, beta blockers, anabolic steroids, progesterone hormones, etc. Then there can be low HDL. And certain genetic mutation, as we saw, like familial apoA-I gene mutation or LCAT gene mutation, etc. All these can cause low HDL level in the body. So that was about the causes for low HDL levels. Thank you so much for watching the video. Please like, share and subscribe the channel. Thank you.